but are there any, I guess, patterns or I guess we were talking about these reliable principles that you can sometimes depend on? Can you take me through that?
Reliable principles. Well, the way that I work with both herbs and acupuncture these days, let me think about that for a second. So, when I think about principles, again, I practice Chinese medicine. So, there are a set of principles that underlie how every acupuncturist practices, right? There's this idea of five phases, this idea of six qi, there's this idea of yin and yang. There's some basic fundamentals that come out of Chinese philosophy, but it also thoroughly infuses the medicine. And those principles are fairly simple in some regard. Again, yin and yang is considered the base. Yin and yang, what's that? It's a plus or a minus. It's a here or a there. It's a us or a them. It's a male or a female. It's whatever polarity we happen to be focusing on, right? We live in this world of polarity. Actually, I think we live in this world of unity, but we tend to cotton more to the polarity. It's usually the polarities that cause us trouble or we want to get something done about. And, there's that very famous line from the Tao Te Ching about, the one becomes a two and the two becomes a three and the three becomes a 10,000 things. In other words, becomes everything. And so there's those very simple principles. How much of that do I understand? I understand a little bit from my clinical practice. I'm not a philosopher, and I'm not like a feng shui expert or any kind of expert on Chinese philosophy. But I can say that the principles that come from that make it helpful. It gives some footholds in working with people and helping them with their health and their well-being, or sometimes just their life and how they're navigating whatever they're trying to navigate through. So that stuff is really helpful. Those basic Chinese medicine principles. Is it an excess condition? Is it a deficient condition? Sometimes when I get lost in clinic, I will go back to that rubric right there. This person in front of me right now, this back pain that they have. I saw someone yesterday. This was the very thing that I looked at. Is this guy's problem because of excess, or is this guy's problem because of deficiency? Right? Is it because he's weak, or is there a part of him that's overstrong and stagnated? Very important rubric to be able to work with. Because if he's weak, then he needs some tonification. And if he's strong and there's stagnation, you don't want to tonify that. You will make it worse, right? You need to bust up that stagnation. Again, some very basic principles of Chinese medicine that way. So I rely on those, and they're reliable in treating people in the clinic, and they're kind of reliable in just everyday relationships. They're elements of how nature unfolds, right? These are ways of talking about how nature unfolds. That includes us, our relationships, our families, our businesses, our practices. And then the other thing that I've really cottoned to over the past maybe 15 years is that there's often a constitutional aspect to whatever a person's problem is. And I phrase that as, what kind of a person is having this kind of a problem, right? Am I dealing with someone who's like thin and skinny and dry? Or am I dealing with someone who's like corpulent and they got like lots of extra fluid and they're kind of fat? Am I dealing with people who are like meticulous and always like taking their attention outward? Am I dealing with someone who is often very much focused inward? They can't really look outward. So there are constitutional aspects that also come into play. And so between the basic principles of Chinese medicine and some constitutional considerations that I've learned to look at through some different systems that I've been exposed to, I use that as a way of being able to like zoom in and zoom out on what's happening for somebody. And hopefully so I can be of service.